You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. My first guest is an expert on the topic. His name is Dr. Steve Mascarin. Dr. Mascarin, welcome to the program.
Thank you. It's great to be here.
Now, before we get into today's topic, tell us a little bit about your practice. I guess you have 3 practices.
That's right. I've got 3 locations. It's the Family Dental Center. So we see all types of patients in my practices.
So you don't just do dental implants?
No.
Okay.
No. Most of my personal practice, what I do is about 80% implant related now.
And you have associates that work with you as well?
That's right. I've got associates in each office that take care of all the family dentistry and all the preventative dentistry. So hopefully we can prevent patients from needing implants in the future.
Okay. Now, you don't look like a dentist. We normally, the dentists that come on the program, don't have this sense of style. Do people tell you that? You don't look like a dentist?
Thank you, Randy. No, I don't actually hear that because it's a little different when I'm in my office. I'm wearing my scrubs or my lab jacket and my loops.
When did you want to know you wanted to be a dentist? I always ask that.
Well, it's funny you should ask that because I've wanted to be a dentist since I was in grade 6, grade 7. And
really?
All of my permanent teeth had come in, and you could not see my top teeth. So I was very self-conscious of that.
Is that right?
And it sort of inspired me. I said, you know, I wish I could change I wish I had a different type of smile. And then as I went through high school, there was I heard about all these things about cosmetic dentistry and stuff becoming more popular. So the first thing I did when I graduated was I've got 10 porcelain veneers.
Nice smile. Okay.
Yeah.
Okay.
But I think I feel the pain of my patients when they're conscientious of their smile.
You see, there's a lot of people though that really their smile or lack of a great smile, in their opinion, really affects their lives.
Oh, absolutely.
Holds them back.
Absolutely, holds them back from all kinds of things. I mean, the psychological and emotional effects of tooth loss or a poor smile are, you know, the lack of confidence in social situations. And I hear this every day from my patients, Randy.
Okay.
They avoid social situations. They avoid family parties.
Just because of their smile.
They avoid going out. And when they do go out, they don't really enjoy it because, especially patients that are missing all of their teeth, because they're constantly aware of these plastic teeth covering the roof of their mouth.
That's what they tell you?
Oh, every day I hear this.
Okay.
Fear of intimacy.
Because of their teeth.
Yes, yeah. Kissing, they avoid kissing.
But you're a dentist, of course you would, you know,
well,
think
it's not because I'm a
important.
dentist. I mean, it's a fact out there, whether it's good or bad. Bad teeth, smile is associated with with social status. Confidence to get a job, relationships. It's the first thing people notice. In fact, if you look at those shows that your friend Bill Dorfman does on Extreme Makeover, the things that people notice after having all these other surgeries, which is wonderful, but the things they notice the most are the teeth and the hair.
Yeah.
It's the first thing people see. It's these white teeth. I mean, your body's covered by clothes for 90%, most of the time anyways. And all they notice is your teeth.
You do remember somebody with a nice smile. There's no doubt about that.
Absolutely.
Now, why the focus, by the way, on dental implants? With all the areas of dentistry, why do you like it so much?
For what it does for my patients, I started getting interested in implants about 12 years ago. That's when I started all my training. Because I had a lot of patients in my practice. I've got a denture technician that works for me full time. I've been with her for almost 15 years. That works right in my office. I have a denture lab. So I kind of sort of inherited a lot of denture patients.
Yeah.
And initially when I started doing implants, I sort of limited it to the denture wearers to have snap-on dentures. And when I saw the difference it made in people's lives, and it created a lot of passion in me for the changes it made. When I saw that I could help change somebody's life, restore their confidence, restore their health, watching them be able, and just the simple things that I hear, I can eat an apple again, I can eat corn on the cob.
So in Canada, you know, we're talking about dentures today, we're talking about dental implants. I mean, are there thousands and thousands of people that are wearing dentures?
Millions and millions of people.
Oh, really?
Yes.
And you say, and I love what you told me on the phone, that if they knew how good it would be to have dental implants, to give them something fixed in their mouth, they couldn't go back. Absolutely. You believe that?
I wish, I talk about this with my staff all the time, I wish that I could give a denture wearer at least 2 implants for a day to hold their lower denture in.
Like a snap-in, snap-out?
And they would never go back.
They wouldn't?
They would not believe what they've been missing out on.
But I still hear people can eat steaks and things like that with dentures. Is that just not true? Well, they're not chewing it very well? Or?
Well, when people say that I can eat whatever I want, that maybe they can, and again, I hear this all the time, so I know it's true.
This is your patients talking.
Absolutely.
Okay.
They can put it in their mouth, and the food may be going in their mouth, but they're not tasting it like they should be, and they're not digesting it the way that they should
because it's not chewed.
And it's got an
interesting point.
Dramatic effect on their overall health and nutrition. In fact, absorption of proteins, they don't get the protein that they need, which affects the distribution of the fat tissue in their
So
body.
why aren't they all doing it though? If it's as easy as, like you say, 2 dental implants to give them something that could be fixed.
In their minds, their denture, they're comfortable with it. They don't realize how bad it is. They don't realize how poorly they're functioning and how it's affecting their overall health, confidence, and they've sort of accepted it.
Is this one of those things after the procedure they say to you, I should have done this years ago?
Every implant patient, every set of case of implants that I do, I hear from all my patients, why did I wait so long? And I should have done this years ago. I wish I would have done this when I had my teeth out. And by that
You say
I
the
mean,
denture wearer doesn't even go to the dentist for the most part anymore.
That's right. That's right.
So nobody's telling them to do it? I guess.
Who's going to tell them to do it? They don't know. They don't want to see a dentist. They think they're done with a dentist. They have dentures, right?
Do people still not like
They need
dentists?
to see a dentist.
I mean, isn't it a painful process?
Well, this is another thing that keeps people away from even looking into it as an option, and especially denture wearers, because the number one concern is fear. They're afraid of the unknown. They don't think it's going to. They think it's a long, painful, expensive, drawn-out process. Absolutely not.
They don't complain about pain for the most part?
I've got more than 90% of my patients take Advil the day of, and that's it.
Let's begin with the different categories of dental implant patients that you see.
Yeah, we have. There's basically 4 categories that we see in our office: patients that are missing 1 tooth, patients that are missing 2 or more of their teeth, but they've got generally healthy teeth otherwise, and then we have the patients that are missing all of their teeth, that come to us with dentures or about to have dentures that want something to hold them in. And the other category that we're seeing more and more of, and these are the ones that we really try and reach out to, are the ones that have not necessarily a few, but the teeth that they have left are terminal. The majority or
That means
all
they've
of them.
been told by
That means
somebody
they have to go, okay? And what happens with these people is they leave it, they procrastinate, they let time go on. The problem with gum or dental problems and gum disease, it doesn't hurt. So they put it off, and their situation becomes worse and worse. And emotionally and psychologically, they've been suffering for years with these.
But that's an easy
bad
one for
teeth.
you to take care of.
Absolutely. I mean, this is the thing. One of the
reverse.
biggest misconceptions, you never go without your teeth. In fact, in our office, we do have the capability and the technology to give you a brand new set of permanently attached teeth in one day. So we do have patients. Yeah, we have patients that have dentures that have suffered with dentures.
So somebody watching this, they have dentures, they go in, they could walk out with teeth.
Yeah.
How soon can they eat?
Right away.
Really?
Right away. Yeah.
They don't know what they're missing? Is that what you think?
Unbelievable. I mean, I've got patients cry on me because it's so liberating for them. They feel young again. They feel alive. They can eat what they want, and they can taste their food.
Now, you brought models of dentures. Before we go into the denture, because I have a lot of questions for dentures. The 1 tooth, you talked about the different categories. Why get a dental implant if you're only missing 1 tooth?
What happens when you're missing 1 tooth? The second that tooth comes out, the bone starts shrinking.
In the hole?
Into the hole,
okay.
yes. And the other teeth, the neighboring teeth, will start collapsing towards the hole. So you lose those other teeth quicker. There's more force on the neighboring teeth. And again, the problem is it doesn't hurt, it doesn't cause pain.
So is that obviously where it all starts? 1 tooth?
That's right. It snowballs from there.
Is there any proof, though, that if you did a dental implant, that you may stop that process? That means the future loss of teeth?
It's basically not even up for debate. There's so much research behind it. As soon as the implant goes in to that missing space, it will stop that bone loss.
Why? I mean, what is it? The
Because
pressure?
it's almost like, I give the analogy. It's like the bone in your arm. If you cut the muscle in your arm, there's no stimulation for that bone, so it will shrink and deteriorate.
And that's what happens in the mouth?
Exactly, same thing.
Okay, now 3 and 4 teeth. People missing 3 and 4 teeth. Very common.
Yeah, it's very, very common because you're missing 1 tooth, you leave it, and then all of a sudden, it happens over time. But before you know, you're missing 2, 3, 4 teeth. Those patients start to pay more attention because they're getting really nervous about a denture, and rightly so.
Are those the people that need to really do something?
Absolutely, because no matter what we do with dental implants, there is nothing like your own teeth. There will never be anything as good as your own teeth. So if you can save them and prevent the damage from happening, it's
So you don't need a
better.
tooth for every tooth that's missing?
No, and this is one of the biggest misconceptions. We can talk about the other misconceptions after, but one of the biggest misconceptions is it's so expensive and so much work and so painful. I've got to get every single one of my teeth replaced with an implant. So and they start counting their teeth. I need 28 dental implants and 28 teeth to go on top. But it's far from the truth. If you're missing 1 tooth, 1 implant. Okay?
All right.
If you're missing 3 teeth, sometimes you can get away with 2. But the remarkable thing is if you're missing all of your teeth, now we have the technology, in most cases, with 4 implants, you can have a permanent set of full upper teeth or full lower teeth supported by 4 implants.
Something that just snaps in there?
No, this is permanently,
permanently in there.
Permanently attached.
We're going to take a quick break. Let's take a look at the model after. You also have some, what are those, denture models, what you could do for them?
That's right.
Okay. And also the process. I want to know what people can expect on day 1, the downtime, and things like that. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know if you're a denture wearer about your options for dental implants. We'll be right back.